Hello, I want to talk about healthcare in Thailand. When I first came over here, I had fallen on the sidewalk in America and banged my knee up. Not so bad. I just put a bandage on it and said, okay. But when I got here, Noy said I should actually go to the hospital and have them look at it. So took my passport and my insurance. I have Federal Blue Cross Blue Shield. Went to the hospital, they took my passport and insurance card and sent me back to the doctor, and he came in and looked at it. The nurse, she cleaned it, put a new bandage on it, and scheduled me an appointment for the next day. And then we went to the cashier and they took my information, and the bill was like $80, and the whole thing was like 45 minutes from the time I walked in the door until I left. The next day I go back, they changed the bandage, scheduled me an appointment for the next day, go to the cashier. This time the bill was like $25. I paid it. Third day, go back again, clean it, change the bandage, schedule me an appointment for the next day, go to the cashier. Cashier says, your insurance has covered everything. They gave me all my money back that I had paid. And so the fourth day, go back, same thing, change the bandage, clean it, go to the cashier. I didn't have to pay anything this time, but I had an appointment for the fifth day. Fifth day, go back, same thing, no charge. I could skip the sixth day, went back the seventh day, and I had to see the doctor that day. Doctor came in and looked at it and said, looks fine, so you don't need to come back anymore. And it was no charge for that either. So my health care for that was great. I don't know if everybody's gonna have that or just Blue Cross Blue Shield, Federal Blue Cross Blue Shield. There was another time that I had an ingrown toenail. Go back to the hospital. They always take your blood pressure and temperature when you go in there. Well, this time they took my blood pressure and it was like 165. That was a little high. And the surgeon was busy. So he said, do you want to see a cardiologist while you're waiting? I said, why not? So we went, and he did a blood test and checked my blood pressure again. And it was still a little high, so he thought, maybe you need a medication for daytime. I was already taking blood pressure for evening, but this time he said, maybe one for morning. And so he prescribed that, and then I went down for surgery on my toe and had that done same day. And this time I was in there for like 2 hours in the hospital, and the bill was like $200, and I had to pay that one, but I had to come back the next day because they were going to change the bandage every day again. So I came back the next day, and next day they just cleaned and changed the bandage, and go to the cashier, no charge. The insurance has already covered it, and they refunded the money that I paid the day before. Third day, same thing, no charge. Fourth day, no charge. Fifth day, no charge. I could skip the sixth day. Seventh day, the doctor came in and looked at it, and he said, it's fine, you don't have to come back anymore. If I had paid for it, it would have cost like $50 because I saw the doctor that day, but no charge. Insurance paid everything. About a month later, I went back to the cardiologist because he prescribed some new medication. And that's what I like about this place is they actually listen to you. And the medication he prescribed for my blood pressure was, I had developed a tickle in my throat, which made me cough sometimes, not a lot. But Amnoy said, he coughs. And the doctor said, oh, you're coughing, so I'm going to change your medication. Well, like everybody else, I never read the side effects of the medication, but one of the side effects of that new medication was you could cough. So he changed that, and my cough went away. In like a week, maybe 2 weeks, it was gone. And all of this was no charge. The insurance had already covered everything. So I went back. He gave me 3 months supply of my medications. In America, they would just mail them to me, but here I have to go pick them up. And I went back, and this last time, they did EKG, blood test. I had to fast for the blood test. And he went over my results. I had to wait an hour for the results of the blood test. And he went over those and said, oh, my cholesterol was a little high, which was not that bad. My good cholesterol was fine. My bad cholesterol was a little high. My blood pressure was fine. My sugar was a little high. And of course, I'd put on a little more weight. And so he was looking at all those things, and he said, your blood pressure, your bad cholesterol, and your weight, and your sugar, says, I'm going to prescribe some diabetes medicine, Rebellus, in small dose. So now I'm taking that. And that bill that day was like 40,000 baht, which is like $1,150. But I didn't even have to show my card anymore. It's free. Everything was free. So my experience here has been great. I have not paid anything for my medications or treatment since I've been here. And I've gone to the hospital. They change the bandage every day if I have to do that. They don't do that in America. They say, here you go, $50 copay, and see you next time. Here they say, come back tomorrow. They change it all. So, and it's fast. Most of the time, if they just have to change the bandage, I'm in and out of there in 45 minutes. If I have to see the doctor, most of the time, less than 2 hours. It's good. One time I had to go wait longer because I went and had turned into lunchtime, and so that day I had to wait like 2.5 hours, 3 hours. But my experience has been great here, and it has been free. So check with your insurance company. There's no copay. All the medicines are free, and they're the same ones that I get in America. So it's great.